as compared to their counterparts. Anxiety was 38% higher and stress was 46% higher. So I think the topic of today's discussion, apart from your passion to talk about it, has immense relevance with respect to the youth and young adults. Now, beginning with what exactly is mental health? Uh, for it to be more discussion based, as I initially mentioned, I would like anyone to answer what they know about mental health. I'm assuming that the audience with which I am talking at the moment, they are not from psychology. I'm assuming that. So, Iman, can you hear me?
Yes, I can hear you.
Okay.
Yes, yes.
So,
We can hear you.
okay. Okay. So, I was just asking for my understanding, the youth or the girls with whom I'm interacting today, I'm assuming that you guys are not from psychology background.
They're not. Mostly are
So,
not.
for my understanding, yeah. So, from my understanding, what do you know about mental health, so that it can be more interactive, more discussion based, more relevant uh, topic rather than a with due respect, rather than a boring slide presentation. So, what do you guys
Can
know
I
about
answer?
mental health? Yeah, sure, please.
So when I think of mental health, it basically, in my understanding, I think directly of the brain and how it functions around people, like the psychological and social well-being of a person's uh,
Hmm.
mental health.
Hmm. Hmm. Okay. So, Iman, I'll add to your point that you just discussed. Uh, Mental health is the emotional, psychological, and the social well-being. How we are thinking, how we are feeling, how we are dealing with the ups and downs of the life, which are the part of the life. We can't control them. But how are we as an individual responding to those ups and downs? How are we coping with them? How are we engaging with different people? How are we overcoming the challenges that we are facing? How are we managing stress? So, all these things are more or less somewhere, I won't say controlled, but affected by our mental health. So, when we say good mental health significantly doesn't mean that a person is feeling good or a person is happy. Good mental health means, if I may mention few characteristics of a person who might have a good mental health, the individual will have effective effective coping mechanisms. The individual will be able to manage stress. The individual will be able to manage the distress coming from relationship, job, the distress from coming the distress coming from everyday you can say conflicts or stressors. So our mental health is, you can say, significantly impacting all areas of our life, whether it's our relationship, whether it's our work, whether it's our overall physical well-being and our own relationship with our own self. It's impacted by how we feel mentally, how our mental health is. Nafisa, next slide, please. Okay, all right. So, okay, next slide, please, Nafisa. So, moving ahead, what is environment? When we talk about environment, there are several different factors which are included in an environment. It may include the physical spaces which surround us, including our home, school, neighborhood, shopping malls, places that we visit. It may include our social relationships. They are also part of our environment. The family with whom we live, the friends, the peers, the classrooms, the random people we meet and we might encounter in our day-to-day life, they are part of our environment. And then there is a digital environment, the social media that we use, the online communities that we have joined, the pages that we have followed, the different, you can say, communities on which we, you can say, gather information and share stuff. So environment can be internal as well as external. I just defined the external environment. Yeah. By internal environment is what are the thoughts that go on in your head and how you're physically feeling, your energy level, your overall bodily health. That's your internal environment. So all these factors have an effect on our mental health, both the internal as well as the external environment. And they influence how we are working in our day-to-day life. Quoting some more facts, according to WHO, now let's move a little bit worldwide outside Pakistan, that what is the relevance of this topic. According to WHO, 1 of 7 adolescents experience mental health disorders, including depression, anxiety, behavioral disorders, and suicide is the 4th leading cause of death amongst 15 to 29 years old individuals. So the significance of this topic is as important as the significance of physical well-being and physical health. And in today's discussion, I will try to summarize and share the factors which might predict that somebody's mental health is maybe struggling, maybe on a verge of a breakdown. What are the measures that we can take as an individual to help ourselves, to help our counterparts, our friends, or family members, and how maybe we can reduce the level of stigma attached to the topic. Okay, so there are different types of environmental struggles that we go through, Iman and Faiza, because I can just see both of you. I don't know whom I'm talking to otherwise. Okay.
Guys, if anyone wants to, so you can on your cameras.
I hope the Zoom doesn't crash if we all switch on the cameras, but okay. I would like both of you to engage so that it can be an engaging conversation.
Of course.
Okay,
Sure.
so let's start with the home environment. In our home environment, the people living in a joint family may have extended individuals such as Dada, Dadi, Chacha, Chachu, cousins. In a nuclear family, siblings and parents generally. Now, the overall house environment has a significant impact on our mental health. If it is a stable, loving house environment where the children experience a secure attachment, the child will be, you can say, secure and emotionally stable. But if the overall house environment is chaotic, it's unstable, you don't know what you might encounter once you go back, you feel anxious with the thought that you have to go back home, you feel like running away from home. If an individual feel these things, these symptoms, there is a good probability it's not a safe house environment. And if it is not a safe house environment, the probability of an individual getting into or encountering a psychological problem is, you can say, multiplied or amplified in comparison to a safe, secure house. Because even in a safe, secure house, a person can acquire psychopathology or mental health issues if there is a genetic background due to the genetic or heritable factors. But if it is a unstable house environment, you can say the probability has been amplified. Okay. So there is a good probability that the individual might experience stress and trauma. The individual will try to maybe run away from his home environment, and the individual might have significant emotional and self-efficacy related issues. In comparison, let's talk about the school or the educational environment. All of us, generally, the second most significant institution that we visit after home is the school, the college that we visit, right? So if our school or college is, you can say, toxic, if I may use the term toxic. By toxic, what I mean is there is a lot of stress, there is a lot of pressure, there is bullying, there are dominant teachers. Recently, yesterday, I was going through a report shared on one of the psychological groups that I've joined. It was a report from King Edward Medical College. I won't call out the teacher, but the report was that one of the medical teacher has been beating up his students with sticks. And there was a full report shared on social media of how the students were significantly encountering anxiety and, you can say, emotional breakdowns. And they were afraid to visit that teacher's class. They didn't wanted to sit in that class. There was a whole, you can say, document shared in the group. So if the educational environment is not safe, it's anxiety provoking, the student doesn't share a healthy relationship with the teacher, there is higher probability that this student will have low self-esteem, this student will have low confidence, this student will have low motivation. At school level, if I may add to this student will significantly manifest physical symptom as well. बच्चे जो है ना वो चूंकि रिफ्यूज नहीं कर सकते, तो वो बताएंगे कि हमारे पेट में दर्द है, हमें वॉमिटिंग हो रही है, किसी तरह ताकि स्कूल ना जाना पड़े. इन कंपैरिजन अगर हम यंग एडल्ट्स की बात करें तो मोटिवेशन लो होगी, एकेडमिक रिकॉर्ड लो होगा, एकेडमिकली दे वोंट बी अचीविंग मच एंड दे वोंट हैव द मोटिवेशन टू achieve much. And adding to that, they might have a very low self-esteem and self-confidence that we won't be able to achieve. That's how, you can say, the initial school encounters shape their identity about themselves, right? Okay, then comes the community and neighborhood. Okay, in order to explain this influence that the community and neighborhood has on mental health, let me ask you guys a question. In the recent 1 week, Pakistan was on the verge of going for a nuclear war. And schools and universities were closed. We were all at our houses. I also happened to teach at a university, so I was also home. We were preparing lectures for online classes. You were also maybe looking forward to online classes. So my question to you people is, how did it feel emotionally, knowing that the environment in which you're living is not safe? There are drones falling in Lahore. There was one in Walton, a few in Walton, not one. There were missiles here in Gujranwala. So how did it feel when you knew that, okay, the neighborhood, the environment in which we are living, it's not safe? कैसा महसूस हुआ था आप दोनों को?
I felt panicked.
Panicked, and also it was a type of exhausting
Mhm.
to be on the edge at all times.
But then at the same time, I would like to add, I was so, I don't know, it's weird, but online classes, I was relieved. I missed my friends. But this online class thing, I liked it because there was just no hustle going on. I didn't have to interact with so many people every day. Just like the normal, usual university things. I was kind of relieved as well.